Welcome to the Medical Receptionist Network podcast show. I am your host, Shivhon Adkins. Join us as we discuss the importance of clerical and administrative roles and their impact on the healthcare industry. Hello, and welcome to another episode of the Medical Receptionist Network podcast show. I am your host, Shivhon Adkins. Welcome to episode number 23. It is March 2022, and we are recording episode 23 today. I just want to always remind you to subscribe to the podcast on your favorite podcast player, whether that's Podbean or your iTunes, Amazon Music. We're on all the great platforms. Also, make sure you visit our website. You can check out our online course as well as some of our links to different affiliates for if you need new glasses, if you need CPR and first aid training, pro first aid, and with pro trainings, they actually have a great CPR and first aid course that can be completed online along with some other HIPAA and fire safety and self-defense courses. So if you yourself or maybe your office hasn't had an opportunity to get everyone trained this year, this may be a great option for you. So if you visit our website, medicalreceptionistnetwork.com, scroll down to the bottom, the link is there. You can check that out. I have actually completed the CPR and it was a great course, very informative, and I definitely recommend it. And also, if you have not invested in the Medical Receptionist Handbook to Success, you can visit our website also for the book, or you can add it to your Amazon cart. And recently we had a little issue with our online form. So if you're a manager or a practice administrator, you were looking to enroll your practice in the group online training, that form has been situated now and it's up and running. So if you visit medicalreceptionistnetwork.com and go to online courses, you're able to fill out the form and I can get your group enrolled to complete the course if that's something that you're interested in. And also for those individuals who are interested, you can also just purchase the course through our online store. Moving forward, today's topic is, why aren't things working out with our front office? There's many reasons why the front office may not flow. So why aren't things flowing? The first thing that always comes to mind is going to be communication issues. You have personality conflicts and, just different work type, work styles that people have, and maybe people are used to doing things a certain way and things have changed. So when you have personality conflicts, the easiest thing you can do is probably listen to each other and show respect. That is the best way to try to hear each other out, come to solutions and resolutions together for the better of your front office and for your patients and even for yourself, because who wants to work in a hostile work environment? And one of the other issues that you sometimes see that can cause workflow issues is improper training. So generally, many offices have on-site training with other staff members, maybe a manager, maybe a supervisor, or someone who does your exact position and performs the same duties that you'll be required to perform. And if you come into a practice or facility at a time where they're extremely busy, you may not get as much training as you need. You may be able to observe a lot of things, but things might be moving really fast. And then by the time you're thrown into actually being the one responsible for taking care of the requests and dealing directly with patients, you are not ready. And so maybe at this point, you or your coworker might be asking way more questions than expected. They're not pulling their weight because they don't want to make a mistake, or they just have no idea what's going on. Or you have a great offer for your training, or maybe you have online training or other systems training, but the person themselves just did not pick up or learn everything that they needed to learn in the time frame that, say, your average employee has learned it in. So what do you do then? Usually, you're going to observe, you're going to see where those issues are, and hopefully they can either repeat the training or spend a little bit more time with a seasoned coworker or a manager to get a better understanding. And some offices, especially hospitals and larger facilities, have different things in place where they can not necessarily test, but do kind of a skills check, or maybe having someone being observed if you have enough staff, or to do that, to observe them, and so you can maybe redirect them in their interactions with patients or over the phone as they're going through it, instead of letting them complete it wrong and then you tell them what they did wrong. So sometimes if someone is having issues in a specific area, observing them when they're making those specific kind of appointments or dealing with a specific type of phone call, or any kind of issue of that sort, maybe you can observe them, give them direct feedback so that they can see where that issue is. But having improper, not enough training is always going to sometimes cause an issue and cause a workflow. Now granted, it takes time for people to be onboarded and to become fully integrated, right, with your front office staff, and to understand their full workflow and to know all their responsibilities. But we kind of always have a benchmark of where people should be at 1 month's time, where people should be at 2 months' time, where they should be, in week 2. And that always depends on the type of training that they receive. So that will depend independently on your group or practice. And if you think you need more assistance in that area or a better program, you need to re-examine what you do have to offer. Do you have reference materials? Do you have instructions, that people can reference? Is everyone struggling in this one area? And just have to look at it that way and see what else you can do to make it better. And if you're not in a leadership role and it's you who is having the issue, make sure you know who to speak with directly to get your questions answered so that you can have a better understanding of your position. Another issue that we see with why the office may not be flowing correctly is because you have seasoned employees who aren't adjusting to some of the newer changes. So perhaps, you've been doing something for a long period of time, and we've definitely discussed this before, but now it's totally different and there's no choice, right? You have to do it in a different way. Some people are resistant of that. Some people are not welcoming of it, and maybe they are doing things the old way and causing whatever the next steps are to take more time or to be incomplete, or something is missed because something went on an actual physical piece of paper as opposed to inside of your computer system or your EMR system. So sometimes we have to retrain our seasoned employees because they do a wonderful job. They're going to be great with your patients. They understand the dynamics of your providers, your clinical staff, and they understand how the place works, but they may not like or adjust well to different changes that may have taken place in recent time. So you always want to be encouraging and acknowledge that, and also put some things in place to help them adjust, and also to work with your newer staff or younger staff, just depending on what you're dealing with. You want to make sure that you have some things in place, or at least pay attention to see if those type of issues are taking place at your front desk. And if you're at the front desk and you're experiencing that issue, make sure again that you discuss with your leadership or your manager so that everyone can kind of get on the same page, because that's going to allow you to have a much more high-functioning front desk process. So a couple ways to encourage people to improve their performance is, providing step-by-step documents on how to do things so they always have a reference. They're not always depending on you to provide them information. They're not always worried about interrupting you. They have reference documents and, step-by-step documents. And if you keep binders and things like that people reference all the time, make sure you're going through them maybe once a year. As how we spring clean at home, maybe you do that in the office and you go back through and say, hey, does this still apply? Do we still do this? Do we still work with these referred to groups? Or, or do we still want to hand this document to patients as it is? And things like that, make sure you're looking through everything, updating what needs to be updated, and keeping current. The other thing is ask staff, coworkers, and colleagues what they need. Ask them what would help them. Because if someone is struggling, usually they know that they're struggling. It's been brought to their attention. They've been written up. They've had meetings. Maybe even a patient has addressed something with them, or one of your physicians have addressed something with them. So you have to ask them also what would help, because people learn differently. People understand differently, and maybe someone understood a process to be one way because of where they worked before. Maybe that's how it was done, and they thought that was the only way this particular process should go, and they joined your group. You all do not do it the same way. So you just have to ask, because sometimes what you're assuming or thinking that someone's not paying attention or they're ignoring the instructions, maybe they just really do not know. And you just have to ask them, or ask people to explain things back to you. That's a really good one. If you explain something or you show someone how to do something, ask them to show you right back, or what did you hear me say kind of thing, so that you know that they understood your direction the way that it was meant to be given. And also letting people observe you. Some people like to watch, so if they can watch you make appointments or listen to a few of your follow-up calls, or maybe listen to you work through a patient complaint or a more hostile person, then they will feel more comfortable in what steps they need to take or how far they need to do something before having intervention with a manager, or what kind of documents they need, what they need to hand to someone, about just seeing how long interaction should take. Maybe your average appointment, you take 2 to 4 minutes to get someone scheduled for a regular checkup, but if they're having a procedure or something of that nature, maybe those calls go 5 to 7 minutes, but at least they can kind of see what you've done in that time to get that patient squared away and all set up. Another thing that also causes your front desk to not flow is a demanding patient population. And when I say demanding, everyone expects things to be done right. Everyone wants their one-on-one time with their providers. Everyone wants to be respected and communicated with at the front desk. However, there are some people that just require a great deal of more time, whether it's on the phone, in person, via email, the portal. Some patients just need more time. They need more explanation. They have more questions. They have more requests. And that sometimes can be a little disruptive when you are running a busy practice, right? And you have lots of patients coming in and out, lots of phone calls. And, you have that one person who you have to be on the call for 15 minutes with. And while there's not so much you can do about that, but knowing everything else that you have learned in your training, you will know how to get those calls cut down by a few minutes by asking the right information from the patient, seeing what they're over. What is your goal here? What is it that I can help you with? What can I do for you? What is the final outcome? What do you want to see here? Because that way you'll know, can I actually help you, or am I more so listening and taking a very detailed message for a manager, a nurse, or a doctor, in your group, or a therapist or something like that. So sometimes you just have to listen, and you have to be patient, and you have to pick out the key points that are being made, and then reassure the patient that someone will get back to them, and hopefully the policy and the procedure in your office will have someone getting back to them pretty soon. When you're dealing with this in person in the office, a lot of times asking people, can you, have a seat? I'll be right with you. Can you give me a moment? I'm going to help the other person standing here, because there might be people who just literally need to write their name on a piece of paper, and there's someone who's standing there for 10 minutes and you're developing a line. So just politely asking someone to move over, or maybe you slide the sign-in sheet over to the side, just being aware of your surroundings, because I've seen numerous times where a front desk staff gets so caught up with the person in front of them, which we should be focused on, but there's 3 people behind that person, and now those people have been standing there not acknowledged, not instructed to do anything, and they can become frustrated. So you have to definitely learn how to manage the room, manage the multiple things that may be going on at once. Always as politely as possible, respectfully as possible, and making sure that the patient is getting what they need, but that everyone else is also being taken care of. And another issue that sometimes affects the flow is the different types of providers that you work with. Again, just like patients, some providers need more information to see their patients. They want to make sure maybe the records are available to them, that they have images, that this patient has multiple orders, and that they are being scheduled for different procedures right away. And they may come up to you and communicate directly and say, hey, I need this person, to get in with this doctor next week, and I need to make sure they have a copy of these labs and this. And this might be their level of detail with majority of their patients. And so when that person is working, maybe that's not your doctor that's on every day, but when they're working, you are, experiencing a different flow than you normally would. So in that case, you have to be also prepared for that. So knowing the things that they usually ask for, right? So you can prepare if you have downtime and this provider is seeing Mary Jane. Mary Jane appears to need, a surgical consult or a copy of her images. You can begin to get whatever you need to get ready for that, whether it's a consent form, a release form, just making copies, anything like that. So just being forward thinking will help you to keep the flow and keep things moving along as if it were any other day. even though a provider may require a little bit more time and effort from you immediately, as to where another provider may order all these things for a patient and all you have to do is give them their discharge summary and then call them later to schedule, and they're okay with that. Some providers may want everything done right then and there on the spot. And that's kind of what I mean by, different provider styles, because that happens, right? That happens in medical hospitals, doctors' offices, all different specialties. And the last thing that can sometimes cause an issue is your lack of compassion and appreciation for the job. If someone has a bad attitude or a negative attitude, the energy within the office is going to feel different. If the person you work with every day is rude, they don't greet you, they don't greet the patients, they're doing their job, but it's literally, I'm here for a paycheck and I'm going home. And everyone's here for a paycheck, right? When you work, you want to be compensated. However, we work with people, we work with children, you work with elderly people, you work with sick people. Everyone that is coming to your place of business needs some kind of health care. And that is a very personal experience. So it is very important that you try to at the least be pleasant with everyone that you encounter, because you, again, do not know what anyone is going through, and they don't know, what you're going through. So you can't expect them to respond to you in your negativity, and they can't expect for you to respond to them, the same way. So the best is to keep everything cordial, greet people, look them in the eye, help them out, get them whatever they need. And hopefully you'll be fine. But definitely, if you're having a bad day, you need to step away from your desk, ask for those moments. I'm sure your colleagues understand. Everyone has a bad day. So that's all I have for us regarding why aren't things flowing. So there could be countless reasons why things don't flow, but those are some of the obvious and also, I think, more important ones and things you can do something about, right? Everything can be resolved in some way or made better in some way, even if it's just saving yourself 2 minutes by not having to make an extra click on your computer, so different things like that. It's always, good to explore your different options. So today I'm going to read an excerpt from the Medical Receptionist Handbook to Success. And this one has to do with taking messages. It says, it is not the length that is important. The accuracy and clarity of the message is key. If you find that your caller is not being specific enough, have a few questions that will get the information to the doctor, nurse, or manager so that they can answer. For example, what symptoms are you experiencing? When did this start? Have you used any over-the-counter treatments? How long have you had the pain? When was the last time we refilled your prescription? Where would you like the letter sent? And then, depending on the nature of your practice, develop a short list of questions that will be appropriate and also save time during the call. Correct spelling of names, dates of birth, and phone number are also key, not only for messages, but for privacy and protection of the patient. If the patient is not willing to volunteer any information, at least they can be identified and assisted by the clinical staff or management who will be responding to them. Okay, so that is our excerpt for today. So take good messages. So today, our definition is going to be CPT. So what is CPT? CPT is the current procedural terminology, and it refers to a set of medical codes used by physicians, allied health professionals, and non-physician practitioners, hospitals, outpatient facilities, and laboratories to describe the procedures and services they perform. We use the term CPT all the time. You see the codes coming up on your super bills or, in your checkout. Many people may not know that CPT stands for current procedural terminology unless you are doing some billing or you have had to reference the book to help out with some coding in your office. That information came from the aapc.com. There's a lot of great information on their website. So if you didn't know what CPT is, now you know. And last but not least, our funny for today. And this is courtesy of rd.com. So this particular list is medical transcription errors. To paraphrase Mark Twain, be careful of medical transcripts. You may die of a misprint. The first one says, social history reveals this 1-year-old patient does not smoke or drink and is presently unemployed. Well, I hope so. The second one says, on the second day, the knee was better, and on the third day, it disappeared. Discharge status, alive, but without permission. Oh, shucks. The next one says, exam of genitalia reveals that he is circus-sized. The next one, occasional, constant, infrequent headaches. So that's headaches all the time and never. The last one here says she is numb from her toes down. So if you do transcription, make sure you're double checking and rereading so that you don't have any similar errors like these. Thank you guys for listening. Please visit medicalreceptionistnetwork.com. I am your host, Shivhon Adkins. Thank you so much. Have a wonderful day. Bye-bye. Thank you for listening to another episode of the Medical Receptionist Network podcast show. Don't forget to visit our website, medicalreceptionistnetwork.com, and subscribe to our newsletter. If you're looking for a great resource for medical receptionists, make sure you grab your copy of the Medical Receptionist Handbook to Success, available on Amazon. Lastly, if you have not subscribed to this podcast, please find us on your favorite podcast player and subscribe today. Until next time, keep being amazing.